There are three factors you consider before going on active surveillance: your PSA, your Gleason score, and the results of imaging. Active surveillance, the idea of monitoring prostate cancer, has become very mainstream in the last few years. And of course, the important question is, who's a candidate for active surveillance? Because we know not all prostate cancer can be safely monitored. The answer is defined by several specific parameters. You need to be aware of the fact that in the prostate world, PSA, a blood test, is very important. And the grade of the cancer as it appears under the microscope, the Gleason grade, is also extremely important. And those are the two primary driving issues. A third factor has to do with imaging. I'll come back to that in a minute. First, the PSA. The higher the PSA is, in general, the cancer tends to be worse. And the threshold for monitoring that is typically used is a PSA of around 10. So a PSA under 10, safe to monitor. A PSA over 10, not safe to monitor. Like anything in the human realm, there aren't, black dividing lines. So let's say a PSA over 8, you start to wonder about monitoring. Let's say a PSA under 15, maybe you can consider monitoring. Okay, there are other factors on PSA, but that's a good way to define that. Let's talk now about the grade of the cancer on the biopsy. And the grade goes from 2 to 10. On a needle biopsy, which is how men are diagnosed, you can't have less than a 6 on your Gleason grade. So it turns out that the safe type of prostate cancer to monitor is 6, and the kinds that you typically treat are 7 and above. So a grade 6, a PSA less than 10. Now back to the imaging question. With modern imaging now, they can often see the cancers in the gland. And so there aren't any specific guidelines yet, but certainly if the tumor is large, or if there's obvious evidence that the cancer is coming through the edge of the prostate gland, that would be a sign that that person has a cancer that should not be watched. So those three components are necessary for deciding who can do active surveillance: the PSA level, the grade, and the imaging findings.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.